Have you ever heard someone describe tasting a word or seeing a distinct color when they hear a specific musical note? These unique sensory experiences hint at a fascinating neurological condition. Doctors confirm synesthesia primarily through a series of detailed clinical interviews and consistency tests. Unlike many medical conditions, there is no single brain scan or blood test to definitively diagnose synesthesia, as it is a subjective experience, uniquely perceived by each individual. The core reason this clinical approach is necessary is because synesthesia involves unusual cross-activation between different sensory or cognitive pathways in the brain. It is not a disease or a mental illness, but rather a different way of experiencing the world. The connections are deeply personal and consistent for the individual, making their report crucial for understanding. When a doctor or neurologist suspects synesthesia, the diagnostic process begins with a thorough intake interview. During this conversation, the individual describes their specific synesthetic experiences in detail. For instance, what color the letter A always appears to them, or what texture a certain sound feels like. This initial discussion helps to understand the nature and consistency of their perceptions. Next, a crucial step involves what are known as consistency tests, often administered over multiple sessions separated by weeks or months. For example, a person with grapheme color synesthesia might be shown a series of letters or numbers and asked to identify the color they associate with each. The responses are recorded and then compared across different testing periods. If the reported associations remain highly consistent over time, it strongly supports a diagnosis of synesthesia. Doctors also rule out other neurological or psychological conditions that might mimic synesthetic experiences, ensuring the reported perceptions are indeed involuntary, automatic, and consistent. A key aspect of this clinical confirmation relies on what researchers call test-retest reliability. This means that if someone consistently associates the number 7 with the color green today, they should make that same association weeks or months from now. This high level of personal consistency is a hallmark of true synesthesia and distinguishes it from mere imagination or memory associations. While there is no single gold standard medical test, this careful, repeated observation by professionals is how approximately 2% of the population discover they experience the world with these extraordinary sensory links. Ultimately, confirming synesthesia involves a careful and consistent assessment of a person's unique sensory connections, relying on their detailed, reliable descriptions of an experience that is truly a part of their neurological makeup. It is about understanding how their brain paints a richer, more interconnected picture of reality.